Good afternoon. I want to welcome you to our Friday press briefing with updates on COVID-19. As of this morning, we've lost over 90 citizens in our community. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we will hear updates from our community leaders. First, we'll hear from City of Albany Mayor Bo Durrell. Mr. Mayor.
Thank you, Chief. I have a few comments, observations today. The first thing, I believe, we would like to announce that I believe beginning next week we will have these press conferences on Tuesdays and Thursdays. My comments today are directed at the community at large. I'm embarrassed to admit that it was probably 10 days ago that I first realized, we heard Dr. Fauci yesterday say that it's not going to be like turning on and off a light switch. Because I was under the opinion that one day on the calendar, all the restrictions would be lifted and life would go back to normal. We now know that there will be a stage of transition. And this transition will in all likelihood be many months. What will be involved? Most of us have seen the guidelines that came from the White House yesterday. Discussion of 3 phases. I won't go into that because I probably don't understand it enough to articulate it, and it's like so many other things in this ordeal, something we will have to work through together. But the first phase, returning to work, we are anxious about that, I understand. But it's my understanding that the requisite for this is that there be at least 14 days where the infection rate is declining, where hospital capacity is no longer under stress, where there are means to test the public at large, and where communities have the ability to do what they call contact tracing. And if you saw the press conference yesterday, you know that means the ability to promptly identify and isolate any person who has the virus. Why do we have to take these precautions, Mr. Durrell? Well, there's discussion. The decision to reopen the economy, to lift these restrictions, which are actually similar but different things, must be guided by science, not public opinion. We have to continue to protect those who are most vulnerable. The various phases of the guidelines, and those are again only guidelines, call for the elderly and those with underlying serious medical conditions to continue to shelter in place throughout the first 2 phases. There are other things, and I want us to be prepared for. I have friends who, to talk to them, you'd think their biggest concern about this ordeal is whether or not there will be college football in the fall. We do not know how long it will be before sports activities resume. It goes without saying, a stadium with 20, 50, 100,000 people is not a good situation where we are still in recovery from this virus. There is speculation that there could be what is called a second wave of the virus. While some models say the virus will be gone by summer, other models say that there will be a rebound in the summer or possibly even the fall. Consequently, we must be prepared to continue to maintain social distancing for months to come, even after the restrictions are lifted. We must continue to obsessively wash our hands with soap and water. We would encourage employers to continue to allow employees who can work remotely to do so. Likewise, if businesses can accommodate employees to allow them to work in shifts, they should do so. Stores, and we would applaud those big box stores in town who have designated special hours for those who are most vulnerable to shop. We want to continue with that. And we also want to be more vigorous. By that, I mean, if you are not an elderly citizen, if you are not susceptible, and a store is setting aside the hours of 10 to 12 for those people to shop, please do not go during those times. Businesses and events will operate under capacity. We've seen this. Once restaurants are opened, in all likelihood, tables will be separated by at least 6 feet. As a result, the capacity of the restaurants will be much less. These are precautions that must be taken. When and if gyms reopen, gyms will be required to exercise and maintain social distancing. I am a member of a gym. I look forward to going back to the gym almost as much to talk and socialize with my friends as to lift weights, probably more so. But we need to remember this virus continues to pose a threat. And as long as it continues to pose a threat, we must adjust our routines and our behaviors. I won't talk about the specifics because we don't know what those specifics are. But I can ask you, please, when you're in public, wear a mask for your protection and for the protection of others. Stores which have implemented one-way traffic, please continue to do so. We do not know if Governor Kemp will continue the shelter-in-place order beyond April 30th. Mr. Kohelas and myself are considering implementing an executive order in the event the statewide shelter-in-place is rescinded. Again, we don't know what the future holds, but we need to understand, and I have admitted, it was only 10 days ago when I fully comprehended this, there will be a long period of transition. We must continue to be vigilant. We had a meeting, a conference call yesterday, the chairman and I, with local clergy. I was very impressed. Ministers had ideas about how worship services will be conducted. Initially, the ministers recognized collectively that worshipers must maintain social distancing in houses of worship, that it is unwise for people to shake hands and embrace. These ministers will continue to have online services to accommodate those who are most vulnerable. This fight will go on beyond the day when the restrictions are lifted. Let's do what we should, not because we must, but because we are citizens who are concerned about our brothers and sisters. Thank you.
Thank you, Mr. Mayor, for your comments. We will now hear comments from Dougherty County Commission Chair, Mr. Christopher Cohelis.
Thank you, Chief. Thank you, Mayor. As always, I want to begin my remarks by acknowledging and giving my condolences to the more than 90 families that have lost loved ones during this COVID-19 crisis. Your losses are real. We understand them, and we are sorry for your loss, and you are in our prayers each and every day. Today, I want to really focus us on what our mission is. We are seeing now some of the benefits of social distancing and the executive orders that we've put in place and that the governor has put in place here in our community. And while we're starting to see some of that benefit, I want to stress this is a marathon and not a sprint. It is too soon for us at this time to even consider going back away from a shelter-in-place environment. We have numbers here that Phoebe Putney has provided us with, and just now we are starting to see signs of the curve flattening. But here's the reality. Just a week ago, the New York Times published an analysis of the areas that had the highest rate of infection per capita in the world. There was the Wuhan province in China, the Lombardy region of Italy, and then there was Albany, Georgia. That is an astonishing and sobering fact that we have to accept, absorb, realize, and deal with as a community. And we have to take actions now each and every day to continue to flatten this curve that we see. And we know we're starting to see some positive results. Because we have been disciplined thus far, we are just now starting to see that the total number of people that are being tested, there's a lower percentage rate of positive tests. We are just now starting to see the total cumulative positive cases, instead of spiking upwards, it's starting to flatten. We're actually now starting to see an overall decrease in the number of people that are being hospitalized every day into our hospital with COVID-19. But let me be very clear. Our medical staff has been strained. They have worked day in, day out, many without breaks. Our first responders have worked day in, day out. We've requested resources from the governor's office, and he's had to make additional medical resources available to us. We cannot afford a spike in this community by taking our foot off of the neck of this virus. And the way we keep our foot on the neck of this virus is to continue to do what we are doing. Our attention doesn't need to be on, when we can go back and do X, Y, and Z right now. We need to continue to be disciplined. There will be that day when we can talk about what it looks like to have some sort of different restrictions in moving forward. And believe you me, I want everyone to go back to work. But the reality is this, and as Mayor Dura pointed out quite correctly, the models that are out there show this. If you immediately just relax and do away with shelter in place, well, guess what? You got a whole bunch of infected people going on with their lives and infected a whole bunch of other people immediately. And then what does that do? Well, we already know that the hospital is strained. We literally have more than 60 people on ventilators at the hospital. They have to have resources in order to be able to maintain those citizens, those patients, those moms, those dads on those ventilators in the hopes that they can actually come off of that ventilator and go home one day. Many will not. Many will not. And that is a harsh, brutal reality that we all have to accept. That this is a test of endurance and discipline. I want to say this. I want to say thank you to our faith-based community. Y'all have heard our plea for there to be deliberate and conscious action relative to funerals in this community. And I was very thankful for the phone conference that I was able to participate in yesterday with Mayor Dura and our faith-based community. I know and have heard, and we've actually set up special funeral details so that we can check the compliance of each of these funerals. 10 or less, period. And I want to thank the pastors who I've heard about, who have literally said, I'm not getting out of my vehicle until and unless I know that there are 10 or less people at this funeral. I will not preach this funeral unless there are 10 or less people there. And for those of you who have done that, I want to commend you and thank you, because you have truly put your people, your citizens, your parishioners' interests at the forefront of your heart and your mind. I want to thank you for doing that, because that is the type of leadership that we have to continue to exhibit in order to continue to flatten this curve. And we have to accept the fact that we've been designated number 3 in the world. We have to accept that and fight it and deal with it. And many other communities are looking at how we're going to deal with that. And it's by being disciplined. I do not yet know what the governor is going to do with respect to his order, but for right now, it is in place until the 30th. Irrespective of what does or doesn't happen after the 30th, we're still going to have to deal with this in our community and be disciplined and diligent. I want to especially thank our law enforcement officers who have been working hard to police a lot of areas that you typically don't police. But many of our law enforcement officers are used to riding a beat or checking, convenience stores, businesses, banks, riding neighborhoods. Instead, they're actually having to go and police funerals. They're having to do different compliance checks at stores. I want to thank them for the fact that they've put themselves literally in harm's way to make sure that everyone is following the rules. I also want to thank the Department of Public Health, and I believe we're going to get some additional information from Dr. Ruiz about some additional executive orders that have been issued by Dr. Toomey. There's some very good information that is available regarding what you should or should not do if you have the coronavirus or you're suspected of having the coronavirus, in terms of self-isolating and what it means to self-isolate. And we're looking forward to getting that information. As always, we continue to work with the governor's office, our local, state, and federal delegations to continue to try and get as many resources as possible to address the situation that we have. We're currently moving, and we're actually seeing Phoebe North take in more and more COVID-19 patients. And I want to say to everybody, we cannot afford to let up, because if we do, here is the reality. If we go back to business as usual, or we start relaxing 1 second, the number of patients is going to spike. The hospital is going to become overrun. There won't be enough resources to take care of the people that are there, and more people will die. That's the reality. We have to accept that reality in order to shape our destiny as a community. I thank you all for your hard work, and I want to thank the citizens, the very large majority of which are doing the right thing by staying safe, staying home, and sheltering in place. Thank you.
Thank you, Mr. Chairman, for your remarks today. We'll move now to update from Phoebe Putney Memorial Hospital. Dr. Stephen Kitchen is the Chief Medical Officer at Phoebe Putney, and we'll ask Dr. Kitchen to come forward for some remarks.
Thanks, Chief. And I will go ahead and provide the update from Phoebe Putney Memorial Hospital as well as for the Phoebe Health System at large. And I think as this projects, you'll be able to refer to a real hotbed of community transmission very, very early in the course of this. And we're still seeing the manifestations of that at this point. That's why, our hospital census had been averaging between 130 and 140 COVID-19 patients a day, and that's just at Phoebe, Maine. Basically, the vast majority of our 60 ICU beds have also been devoted towards caring for COVID-19 patients as well, the vast majority of whom, unfortunately, have been on a ventilator. And again, it's a very, very sobering statistic that the mortality rate for patients who do require mechanical ventilation is exceedingly high. And this is not something that we just see locally or statewide. It's a national and a worldwide phenomenon, and again underscores why it's so important that we really flatten this curve and adhere to all the public health measures we know are ultimately going to be our measure of success. We've had almost 6,000 people in our community who have been tested. And I think one of the effective strategies for, again, curbing the transmission is the availability of rapid testing, because that allows us to discover those individuals who may have very mild or no symptoms at all but test positive, and allow those individuals to self-isolate and dramatically reduce the chances of transmission to family members, friends, healthcare personnel, and other patients in our hospital. We are encouragingly seeing more and more patients who are able to be discharged home, who are recovering from this illness, now over 1,200. To speak to a little bit about the trends that you see here, the first one shows the percentage of patients by day who test positive for COVID-19. In the early stages of this outbreak in our community, what we were discovering was basically about 50% of of patients, or even higher, were tested positive for COVID-19. As you'll see, as this, the line, the slope of that curve is now going downwards and to the right, which is the right trend that you want to see, because what that is telling us, out of the total number of patients who get tested every day, there's a smaller percentage who are testing positive and a higher percentage who are testing negative for COVID-19. And although it's a manifestation, the more availability and access that you have to testing, it allows us to test more individuals who have mild symptoms or none at all. It's also an indication that the rate of transmission, and I want to emphasize the rate of transmission, is beginning to decline. That in no way suggests that without the effective measures that have been put in place, that we're going to curb transmission in our community, because where we really have to get to is where that rate of transmission is really beginning to dramatically decline. The next graph shows new patients who are hospitalized with COVID-19. If you look, for the first couple of weeks, that curve was steadily increasing, was steadily going up at a very high rate. And it peaked somewhere around the latter part of the latter part of March to the early part of April. And at that time, we were averaging over 40 patients a day coming into Phoebe, Putney Memorial, Phoebe Sumter, and Phoebe Worth on a daily basis with COVID-19. I'm going to tell you that is a real challenge, to be able to accommodate that number of seriously ill patients presenting to our emergency room on a daily basis. Fortunately, now you see that curve that is actually going in the opposite direction. It's beginning to go down, and we are beginning to see the average number of cases coming into our facility at this point decline. I'm going to tell you, in my opinion, that is solely due to all the public health measures, the social distancing ordinances, and the other difficult decisions that your government officials and policymakers have put into place. So again, I want to emphasize that if we're going to win this battle, we're going to win it with those effective public health measures that your public officials have courageously put into place. Lastly, I'm going to refer to the last slide there, which is labeled cumulative positive cases. You've heard the term flattening of the curve. This is a visual representation of that, and what I mean by that, it day by day shows the cumulative number of cases that we have in our community. That number's never going to go down, but what we hope is that it's going to gradually plateau. And what that is telling us is that the number of daily positive cases we're beginning to see is really beginning to flatten. In the early part of this, those cases were doubling every couple of days. I mean, we would go from 400 cases to 800 cases within a matter of days. And what you're seeing, and I want to emphasize, we continue to have positive cases every day. So this battle is by no means won, but we are beginning to see evidence that the curve is beginning to flatten, and again, the rate of transmission is beginning to decline. unfortunately, we had 9 deaths that occurred in COVID-19 patients across our health system yesterday. And, you know, I offer my heartfelt sympathy and condolences to all the families that lost loved ones yesterday. And unfortunately, we have seen families that have lost multiple family members. There have been husband and wives who have been lost. And so I think the degree of suffering and the degree of anguish and the degree of heartbreak is just unfathomable at this point. And I continue to be amazed by the morale and heartbreak, the degree of morale and commitment by all the healthcare personnel that are on our front lines, and that goes out to all the EMS and first responders as well. I was making rounds in our ICU shortly before I came here. I went to one of the ICUs that unfortunately lost one of their patients who was a relatively young and very healthy individual that had no underlying medical illnesses. And yet, unfortunately, he had a rapid progression of his illness. And so certainly it had an impact on the physicians and the nurses and the frontline staff. But I will tell you, I also observed they were all huddled together. They were going over every patient in the ICU. And I just can't express the degree of commitment and the degree of resolve and looking at everything they can do to improve the clinical outcome of those patients. And what I will offer to you is that our degree of commitment and our degree of resolve is going to be unwavering. So I think the last thing I want to share is you know, I was just kind of going through my normal routine this morning before I came to work, and I would think we would all agree there's a lot of sage wisdom in the book of Proverbs, and there was one particular passage that just struck me as particularly meaningful today, and it's from Proverbs 18, verse 15, and it's, an intelligent heart acquires knowledge, and the wise ear seeks knowledge. And I think maybe what the good Lord is trying to tell us is that we all have a responsibility to listen. But more importantly, we also have a responsibility to take that information to heart and to apply that knowledge, because wisdom is defined a lot of different ways. But I think you could, one expression I like is that wisdom is the application of knowledge. And so, again, I want to come back to the fact that we know what measures are effective, and we have a personal responsibility, but we also have a responsibility to friends, loved ones, and the most vulnerable segments of our society to continue to practice those measures that are going to ultimately lead to the success in against this very, very deadly coronavirus. So thank you again.
Thank you, Dr. Kitchen, for your report. We will now hear from the Director of the Southwest Georgia District of the Department of Public Health, Dr. Charles Ruiz. Dr. Ruiz?
In case I forget to say it later, let me say it now. By all means, it's important to practice social distancing. If you are sick, stay home, call your provider, and otherwise, you should stay home if you don't have some essential reason for leaving home, such as a medical consultation or purchasing groceries or essential supplies. A lot has been said in the last few days about the benefits of increasing testing for COVID-19 and for contact tracing. And I'd like to say a few things about that and how it applies to us in our community. The Department of Public Health statewide is engaged heavily in collecting specimens to be tested for COVID-19. And that's true here in the Southwest Georgia Health District as well. As recent as a week ago, we were running 3 sessions a week here in Albany and 2 sessions a week down in Thomasville and 2 sessions a week also in Miller County. And as of yesterday, statewide, all of these testing locations were dramatically increased and enhanced and made more accessible. So in our district, all 3 of those locations now will be open for collection 5.5 days a week. We will be doing collections Monday through Friday from 8:30 in the morning to 5 p.m. in the afternoon, and then from 9 to noon on Saturday. To make an appointment, you can call this number, 229-352-6567. We have operators manning the phones Monday through Saturday. Monday through Friday, the hours to call would be 8 a.m. to 7 p.m. That's 11 straight hours. And then on Saturday, we're open from 8:30 in the morning to 5 p.m. That's for calling to set up an appointment. The eligibility is fairly encompassing, and I'll read those criteria for you. You would be eligible if you have symptoms consistent with COVID-19. If you are an adult age 60 or older, or if you care for someone age 60 or older, if you're a caregiver for an immune-compromised person, you would qualify. If you're a first responder, if you are a healthcare worker, you're eligible. If you're a patient with a serious medical condition such as heart disease, diabetes, lung disease, or an immune-compromising condition, you would be eligible. And anyone who lives or works in a congregate setting, you would be eligible for the COVID-19 test through public health at no cost to you. It's a fairly quick and simple procedure. It's a bit uncomfortable. We use a flexible swab. It goes into the nostril, and the swab is slid backwards for a couple of inches, and until we get to the part of the anatomy that we call the nasopharynx. And after a few seconds, we remove that, and it's over and done with. Not the most pleasant thing in the world, but it's not a big deal. So we're increasing the testing, and we will do that until ordered to do otherwise. And what that's going to mean is we're going to get a whole lot of results, and we hope that the vast majority of them will be negative. Some will be positive, no doubt. So the next step is to inform the the patient of the result. And that's going to take some degree of time. And we also will want to be tracing down all of their contacts. And that's going to take a lot of time, a lot of manpower to do that. And so we have repurposed some of our staff members to assist our epidemiology department in doing just that. We have also hired a number of people to help. And that's probably not going to be enough. We're going to need to hire more people, and we're also looking at possibly getting some help from some of the colleges and medical schools in our state, because we do believe that more enhanced testing and contact tracing can help us to identify who is sick and who is most at risk, and it will go a long way toward containing this virus. Chairman Kohelas mentioned something about the administrative order that came down from Dr. Kathleen Toomey, who serves as the Commissioner for Public Health for the state of Georgia. The order that Dr. Toomey has provided talks some about being quarantined and isolation. And let me talk just a minute about what we mean by those terms. So if we are exposed to someone that has the COVID-19 infection, and by being exposed, we generally define that as being within 6 feet of the person for 10 minutes or more. If we are exposed, then there's a significant possibility that we may develop the infection ourselves. The incubation period generally ranges between 2 and 14 days. So if we've been exposed today, over the next 14 days, we want to be very observant to see if we might come down with those symptoms. And while we're waiting, we need to stay off to ourselves as much as possible. We need to stay home, stay alone in the home as much as we possibly can. There are some exceptions to that. If someone is supposed to be on quarantine and if they perform an essential and vital function in the community, such as a healthcare worker or someone who works in law enforcement, there is a provision where that person can essentially step out of quarantine, wear a mask, perform their function, be monitored throughout the day, and then go back home after that shift and resume being quarantined for 14 days. So people who are quarantined are people with no symptoms. It's someone who has been in the proximity of someone with COVID-19, and there's a real possibility that person may come down with the symptoms. Now, by contrast, isolation is for someone who has either tested positive for COVID-19 or someone with symptoms that are classic for COVID-19 or both the symptoms and tested positive. So when we say you need isolation, this is for someone who we're convinced the virus is in your body. You may or may not have symptoms, but we're convinced either by the symptoms or by the test result that the virus is active and it's in your body. You are a threat to other people, no doubt. So we're telling you again, go home, stay at home, and stay away from people as much as humanly possible until it's time for you to come out of isolation. So a minute ago I said that the incubation period is 2 to 14 days. So the quarantine period is 14 days long. So a natural question would be, how long is the isolation period? And the answer is, it depends. It depends, for instance, on whether you have symptoms or not. And if you have symptoms, it depends on how long the symptoms may last. When you are in isolation, it is your responsibility, and this is according to the administrative order from Dr. Toomey, it is your responsibility to contact everyone that you have been close to, going back to 2 days before your symptoms or 2 days before you tested positive, it's your responsibility to let everybody know that they may have been endangered by being close to you. And you should stay in isolation until you have met the criteria to come out. So let's talk a little bit about what the criteria is to come out of isolation. Basically, there are two ways of determining when it's okay to come out of isolation. The first way is called the test-based strategy, and the second is the time since recovery strategy. Now, the test-based strategy was all we had. If you go back to, say, the first or second week of March, and if you look at the CDC guidance, they only talked about the test-based strategy. And this is the way it works. After you have been free of your symptoms, and after 7 days have passed since the onset of your symptoms, if you have the swab done of the nasopharynx, and if it comes back negative, and then if you have another swab done at least 24 hours later, and if both of those are negative, and you're free of symptoms, then you're okay to come out of isolation. Well, that didn't work very well for a couple of reasons. One reason is because, especially in those early days of the pandemic, we had very limited test kits. Furthermore, in most cases, it was taking a long while to get the results back. So it was a very cumbersome thing, and it was good that the CDC opened up another pathway. The second pathway is called the time since recovery strategy, and this is also outlined in Dr. Toomey's administrative order. There are 3 conditions that have to be met. One is that the person's fever has to be gone for at least 72 consecutive hours without taking any fever-reducing medication. The second condition is that the person's other symptoms have dramatically improved. And the last condition is that at least 7 days have elapsed from the date symptoms began. This is the parameter that's, or the strategy that's most often used. It's in most cases, it's quicker and doesn't rely on getting those tests. Let me go back to those tests, and let me talk about one more sort of a hiccup if you are asked to use the test-based strategy. I've already said that you have to have the kit to do it. You have to have 2 more tests, and you may not get immediate results. Here's another issue that comes up. The test that we're doing in the nasopharynx is called a polymerase chain reaction. And I'm not a pathologist and not a specialist in laboratory science, but it's frequently abbreviated and called a PCR test. What this test does is it pulls out mucus from your nasopharynx, and it is tested with sophisticated equipment. And what they're looking for is a fragment of the genetic sequence of this virus. If the virus is alive in your body, there's a great chance that this test is going to show it. It would be a good test. It would detect the virus in almost every case. There might be some cases where it would be a false negative, but it's a very good test. When a person overcomes the infection, it does not mean that all those viral particles will be cleared out of the body overnight. Some of that material that contains the genetic sequence will linger for days or for perhaps even weeks. So theoretically, and probably in reality, if a swab test is done a few days after a person has recovered from the infection, there may still be some of that genetic material there, and it would show up as positive on the test. We would consider that a false positive, And I have a CDC article that talks about how that is a real possibility. I've known of several cases where people have clinically, clearly overcome the COVID-19 virus. Days and days have passed, 7 to 10 days have passed, and because they were going through the test-based strategy, they subsequently had one or more tests to show up positive. So it is still an option to do the test-based strategy to come out of isolation and return to work. But one that is probably more practical is to consider the time since recovery. There are 3 conditions that have to be met. Fever has to be gone, all the symptoms have to be dramatically improved, and 7 days have to have lapsed since the onset of the symptoms. And once those conditions are met, then according to CDC guidance, the person can come out of isolation. It is still very important for that person to wear a mask when they're out in public. It's very important to practice good hand, cough, and sneeze hygiene. If that person works in the healthcare business, we would want that person to definitely wear a mask and stay away from immunocompromised patients as much as possible. So a few more caveats for healthcare workers, but for the general population, once those 3 conditions have been met, then according to the CDC, they can come out of isolation. So we are proud in public health to be part of the team that's helping to combat this virus and to help to keep the community safe. We will continue to do all we can to combat this pandemic. Thank you.
Dr. Ruiz, thank you for the update from Public Health. We will now move toward the law enforcement update for today. And from the Dougherty County Sheriff Department, we're joined today by the Chief Deputy Taryn Hayes, and ask Chief Hayes to come forward for some remarks.
Thank you, Chief. Good afternoon. On behalf of the Dougherty County Sheriff's Office, Sheriff Kevin Sproul, and the men and women of the Dougherty County Sheriff's Office, we would like to extend our sincere condolences to the families that have lost loved ones during this horrific pandemic. The Dougherty County Sheriff's Office conducts on a daily average of 150 to 255 compliance checks to our businesses throughout Albany-Dougherty County. With that, we check essential businesses as well as non-essential businesses. Essential businesses know that they should operate within a 16-point basic operations guide that allows them to stay open for business. Non-essential businesses have to operate within a 20-point basic operation guideline, and that allows them to stay open for business. And we check these businesses to ensure that they are operating within those parameters by the order of the governor's office. We also work with the coroner hand in hand, as well as the funeral homes, to ensure that we are practicing social distance. We are following the guidelines given down by the Department of Public Health as it relates to funerals. We have deputies stationed at the different cemeteries to safeguard more than 10 people at funerals. So we're trying to do our best to fight and combat this horrific pandemic and to keep our citizens of Albany-Dougherty County safe. If you have questions related to if your business should be open, please check the governor's website and look at the executive order and see if your business is critical or non-critical. That will help us out tremendously. We're not here to shut you down, put you in jail, or to give you a citation. We want to help educate you on being better and doing better. Because we have a lot of men and women stretched out across this community with enforcement trying to still uphold the law as well as execute this executive order. So again, check the governor's website. You get a better understanding. If you need help, please contact the Dougherty County Sheriff's Office. Thank you, Chief.
Thank you, Chief Hayes, for your remarks. Now we'll hear update from our emergency medical services. Mr. Sam Allen is the director of the Dougherty County EMS. We'll ask him to come forward for some remarks. Mr. Allen.
Thank you, Chief. On behalf of the department, Dougherty County EMS, I'd also like to express our sincere condolences to the families that have lost loved ones due to COVID-19. It's a horrible disease. It is terrible, and it is real. So with that, I'd like to go through a little brief presentation. As you can see, Dougherty County EMS has totally changed. In the last 38 days, we have changed the format and how we've been handling emergency medical calls. Previously, the paramedics would be back there wearing their gloves, possible eye protection as needed. Now they're wearing Tyvek suits, N95 masks, gloves, eye protection. It's very cumbersome to work in. It's very hot. It's tough to work in. I'm just here to tell you. The staff at Dougherty County EMS has done an amazing job. They run these calls. They don't complain. They do what they're supposed to do, and they do it with the highest level of integrity. So I just want to reassure the citizens that when you do call for an emergency medical service ambulance, they're going to bring everything they can to help take care of you and your loved ones. 38 days ago, we started COVID-19. Once we got into that, we since then have run approximately just over 2,500 calls. When we first started up until April the 7th, we were running approximately 30% of the 911 calls that were actually related to COVID-19. April the 7th was our switchover day. We have been steady climbing on the chart on call volume and calls related to that information. On April the 7th, we crossed over and we've slowly gone down. We have seen an increase in other calls, so we're kind of getting back to a normal range. But we don't want people to relax, and we don't want people to go back to doing the norm. Please keep doing what you're doing. It is helping. The 911 emergency medical calls, we averaged before April 7th, we were running about 541 calls a week, which is 77.3 calls per day. After April 7th, we're now averaging about 449 calls, which comes out to about 64 calls per day. We're getting back to our closer range. So please keep doing what you're doing. Don't stop and don't lax. The department has handled situations like they've never experienced before. They've handled it like true champions. When they go to a COVID-19 patient, the med unit arrives on scene, they have to stop, they have to suit up before they can come into the house. So please bear with them. It takes a couple of minutes to get these suits on. But once they can get the suits on, they get in the house, they immediately start care and treatment. They don't back down. So please bear with them while they're taking their precautions because they don't want to get infected. And I can tell you, out of a staff of 70, we've only had 2 confirmed cases in the department out of 2,500 calls. So please consider that they are doing everything they can to take care of your family members. So as I said, we've seen a big decrease, a slight decrease that is now showing. This is not the time to back away. This is the time to consider practicing social distance, good hand washing techniques. I also recommend keep a little small bottle of hand cleaner with you at all times. I do it all the time. I catch myself doing it now. Used to, I never would, but now I do. And most importantly of all, shelter in place. Can't say enough. That is helping bring these numbers down. It's not a big come down, but we are seeing it. We don't want to see a spike in it going back up. So let's everybody in the community pull together like we're doing, keep doing, and don't let it up. Thank you, Chief.
Thank you, Mr. Allen, for your remarks. Now we move for our update from Dougherty County Coroner, Mr. Michael Fowler, for an update. Mr. Fowler.
Thank you, Chief. My prayers go out to all the families here in Dougherty County, the ones that have lost loved ones, and also the ones that have been in the hospital, the ones that are at home, and also souls to the ones that have been working on the front line. Prayers go out to you and your family. I have a few updates today. As of April the 17th, there have been 91 deaths, positive COVID death in Dougherty County, 91. I didn't believe it was going to get this high. We almost make it to 100, but I didn't want to have to say that, but eventually we're going to make it to 100 the way it's going. I want to thank the ones that have been obeying the orders that have been talked about in the first part of the meeting. I want to say keep doing what you're doing because it's paying off. I'm going to go down the map of Albany from the known address that we have so far. In 31721, we have a total of 11 deaths. That's on the north side. 31707, we have a total of 20 deaths. It's steady growing. On the east side, 31705, we have a total of 20 deaths on the east side of town. On the south side of town, we have a 39 deaths. 39. As I said, one death is too many. 39 deaths. That's a total of 91 deaths we have. The females, we have 49 females, that's 54% of the death, and we have 42 males, 46% of the death. We have 1% Latino, and then we have 21 whites, that's 23%. We have 69 blacks, that's 76% of the population that's deceased. A breakdown of the gender and race. We have 14 white females, that's 15%. We have 7 white males, that's 8%. 1 Latino, a male. We have 34 black males, that's 37%. And we have 35 black females, that's 39%. Breakdown of the age, we have no one in their 20s here in Dougherty County that have died of the virus. We have 2 in the age of 30. We have 6 in the ages of 40s. We have 5 in the age of the 50s. We have 31 in the age of 60. We have 19 in the age of 70. We have 19 in the ages of 80. We have 9 in the age of 90. Breakdown of death location. We have 3 unknown locations so far. We have 68 in the hospitals. That's not just Phoebe, that's hospitals surrounding Dougherty County that family members have been placed there that have passed. 68. We have 14 from the nursing home, we have 3 from the residents that have passed. And the average age is 71 of the death that we have. Again, we have 91 deaths in Dougherty County, residents here in Dougherty County. And like I said, my prayers goes out to each one of the family members. Thank you.
Thank you, Coroner Fowler. We'll pause now for any questions that our media may have. Okay. As we end today, let's continue our social distancing and shelter in place throughout our community. Although it may not feel like it's working, it's slowing down the virus little by little. And let's not falter in our efforts to do everything we possibly can to mitigate the impact of this virus on our community. Everything we do, whether large or small, helps, and we must remain vigilant in doing our part. Let's keep fighting. In addition, I'd also want to let you know that beginning next week, we will be shifting our press briefings from Monday, Wednesday, and Friday to Tuesdays and Thursdays. With that said, our next press briefing will be held on next Tuesday, April 21st at 1 p.m. We will see you then. Enjoy your weekend. That concludes today's press